Hello, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Pam Fields, State Director of Advocacy and Access for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on prior authorization in Ohio. But what do those victories mean for patients and their access to care? The Arthritis Foundation has got you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that patients in your state know their rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. Before we go any further, let's define what prior authorization is. Typically, physicians must fill out a prior authorization form whenever they prescribe a specialty medication or treatment that is restricted or not covered under the insurer's formulary. Each insurer uses its own unique form, and physicians may have to spend many hours familiarizing themselves with and completing dozens of forms of varying lengths and complexities. As a result, prior authorization typically causes lengthy delays in treatment, thereby restricting a person's access to vital care. Under the prior authorization law, what are your rights? Transparency. An insurer must make information about the policies that clearly identify specific services, drugs, or devices for which a prior authorization requirement exists available on its website. Retroactive denials will be prohibited when, on the date the provider renders the prior approved service, 1. The patient is eligible, 2. The patient's condition hasn't changed, and 3. The provider submits an accurate claim that matches the information submitted by the provider in the approved prior authorization request. Retrospective review allowed for a claim where a prior authorization was required but not obtained when the service in question meets the following. The service is directly related to another service for which a prior authorization has already been obtained and has already been performed. The service was not known to be needed at the time the original prior authorized service was performed, and the need for the new service was revealed at the time the original authorized service was performed. A health insuring corporation may, but is not required to, provide a 12-month approval for a prescription drug that meets either of the following. The drug is prescribed or administered to treat a rare medical condition and pursuant to medical or scientific evidence. Medications that are controlled substances that are not opioids or benzodiazepines. What is a rare medical condition? It is defined as any disease or condition that affects fewer than 200,000 individuals in the United States. Benefiting the patient, faster turnaround times for prior authorization were negotiated. For urgent situations, the insurer shall respond and approve or deny the request within 48 hours. For non-urgent situations, the insurer shall respond and approve or deny the request within 10 calendar days. That was formerly 15 days. If the prior authorization is denied, the insurer must provide the specific reason for the denial. If your prior authorization has been denied, here's how to begin the appeals process. Ask your pharmacist what they heard from your insurance company and write it down. Call your doctor and report the problem. See if they can suggest next steps to get your medication. Call your insurance company and find out how to appeal the decision. Your physician often needs to intervene and write a letter. Share copies of any insurance letters or information you receive with your doctor and make sure you stay on the same page. Through the appeals process, you will be working with your insurance company. But first, check with your human resources officer to learn the specific rules for your plan. Check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call your insurance company to find out why your medication did not receive prior authorization. The number to call should be on your insurance card. Find out if your appeal needs to be online or there is another process from your insurer. Keep notes of all conversations, who you speak with, dates and times of calls, and case reference numbers. Having good records helps move future calls forward. Stay in touch with your doctor through the process and share your information. Your insurance company must provide the reason for your denial in writing. Ask about it if you've not received anything. If submitting an appeal yourself, include all relevant documents that may help your case, letters of support from a physician, test results, and your personal narrative. If the internal appeal process with your insurance provider didn't work, you may file a complaint with the Ohio Department of Insurance. Here is the website and phone number for the Ohio Department of Insurance, but remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and received a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit Your Coverage and Care through Prescription for Access. This go-to resource will help you better understand health coverage options, determine how your current plan meets your arthritis care needs, and guide you through the claim denial process. The kit includes information, tips, and tools for consumers to get the most coverage and avoid or minimize claim denials. The kit includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeals process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, tailored solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to health care, information about resources to pay for medication, and community resources. Thank you for listening to today's webinar. We want to make sure that new state laws are being implemented fully so patients can enjoy their new protections.